Patient education and advocacy are really keys to living well with migraine. Education's really important. We all naturally are curious about what's going on in our body. Why am I feeling this? What does it mean? Is it dangerous? Why me? Why am I responding to this or not responding to that? And even when it's kind of bad news, like hearing a diagnosis, there is some comfort in knowing what's going on in your body. Once you have that diagnosis, you can know what to expect as far as the natural course of that disease. You can know what to expect as far as treatments. You can know what to expect as far as finding your community of other people who also live with that disease. So there's just some power and some reassurance that comes with knowing and learning what's going on. And advocacy can be different for everybody, and people will have different levels of comfort. And some people might advocate in a quiet way, like telling their closest family members what happens during a migraine attack and what they can do to help make them feel more comfortable. And some people might advocate in a big way, like in the US, participating in Headache on the Hill and talking to a member of Congress about our needs for people with migraine. And most people will fall somewhere in between. And it also might be a process. You might start with your family and your closest friends, and then expand to your workplace or your school or your children's school, and then expand to advocating for government officials or fundraising through one of our wonderful advocacy organizations. But advocating whatever way feels right for you gives you this sense that you are doing something about this disease. And rather than the disease having control of your life, migraine being in control of your life, it gives you a sense that you are taking back some control of your life.